We're going to begin our meeting at this time. The committee will now come to order. Today is January 23rd, Tuesday, and I detect a quorum.
Yep.
Okay, so
skills.
yes, the first resolution we have in our committee is Resolution 2018-1012, sponsors Bircher and Gilmore. It accepts a grant from the Association of Food and Drug Officials to the Metro Board of Health to provide training to staff members to enhance conformance with voluntary National Retail Food Regulatory Program standards. May I have a motion?
Motion. Second.
It's been motioned and properly seconded. Is there any discussion?
That one and the next one are small grants that association gives to us every year to train the restaurant inspectors. One of them pays for the training and one of them pays for travel.
Okay. Is there any further discussion?
How often are restaurants inspected?
I'm sorry?
How often do restaurant inspections take place? I don't know.
I believe it's at least once a year.
Once a year, because I figure it's random, but I wondered if it was about once a year.
It is it's on a regular schedule, but I mean, it's not, they don't know what it is. I think it's at least once a year. They moved to, for the hotel and motel, and I think the restaurant people too, I believe, a more risk-based inspection. If you've got one place that's just
Habitually
a persistent problem, you may want to go back more often.
Yeah, or if there's a complaint
Never had
or
anything
something.
less than 100, you might go a little less often. So your resources are targeted where you need to target.
Just curious.
No, good question. So what did we come up at? How often do they check the restaurants?
That's what it's like, whether or not it's either once a year, on average, if you own a restaurant and you're consistently in getting a good score, then more than likely you're going to get visited once a year. But if there's a problem, then more often than that.
Most likely.
Or if there's a complaint, then there may be.
If you don't drink and be weary.
Yeah, the Pancake Pantry always has a low score, but they always has a long line.
Sometimes people don't listen to it.
Like
It's the
Satsuma.
ambiance and the networking that
Is that
takes
what it
place
is?
there as well.
I'd like to know what East Nashville Beer Works restaurant score was.
It's supposed to be posted.
Yes, I know.
Stake that place out.
You should be able to see it. Seriously, it's a law.
It's the law. We're ready to take a vote if there's no further discussion. How many for? All right, seeing the majority for, it's recommended for approval. There was no ayes. There's no need to take any other count. So,
Aye.
yes, you're right. No nays. Yes. So it's recommended to the committee, to the floor for approval. By the committee. Okay. The next one is Resolution 2018-1013, sponsors Bircher and Gilmore. It accepts a grant from the Association of Food and Drug Officials to the Metro Board of Health to fund travel expenses for the health department staff to attend the food environmentalist training. May I have a motion?
So moved.
It's been moved and properly seconded. Is there any discussion?
That's the other one. That one just pays for the travel.
Right, okay. So if there's no further discussion, how many for? All right, seeing none against, is recommended for approval. Ayes have it.
Now, what happens at this conference?
I don't know.
Well,
It's training.
No, they go get with the latest food code and best practices.
Oh, okay.
So forth.
All right. Yeah. I just wanted to know.
Right, next time.
They probably all take their leave.
Oh, okay. Good.
Yes. Okay, we have our last resolution, which is Resolution 2018-1014. The sponsor is Gilmore. It approves an agreement to detail for the Public Health Associate Program between the Metro Board of Health and the Centers for Disease Control and Prevention to provide an associate to assist public health agencies in developing, implementing, and evaluating public health programs. May I have a motion?
Second.
It's been moved and properly seconded. Is there any discussion? I'll go
We
with
love
this.
this program. That is a CDC fellow. She will work with us for, I think it's 2 years. Wow. And they pay her salary and benefits, and we pick up very little if she has to travel or something. But basically, we get a free employee for 2 years, and the CDC gets somebody that has some real-world practical
So she's already been chosen? Okay.
She's there.
So those minor expenses are basically travel related?
Yeah, maybe a few $100 a year or something. I mean, they're paying the vast majority of it. For
And then you do a report at the end, right? Does she have to do a report?
Yeah, there are strictures around what she's going to work on. This lady is in the TB area right now.
All right.
Interesting.
There's no further discussion. We are ready to vote. How many for? All right. Seeing that everyone's for it, it is recommended to the council for approval. This concludes our committee meeting. Okay, yes, you have a quick.
I just have a quick
Excuse me.
church announcement. No, I'm just
Pardon
kidding. I just have a committee this here is the Holy Grail for Metro General Hospital and the merger.
Okay.
I had them to get all of the contract, the years. Looks like that the contract is ending in 2024.
Okay.
I would love to sit down and I'm going to have to get with some help to go through this stuff. I don't think nobody has ever done this. This is what we need to look at, especially with the overall and the, as far as the payout and everything else that we're dealing with right now with the hospital. This is the proof in the pudding. If it's not a part of this and it wasn't discussed, or either if it was something that was done just impromptu, we can call that up again. They did a really good job with separating some things for us. So if you would like to look at it beforehand, I would love to let you see it. And you can also get this hospital Bible as well. The hospital thing is not going away. We have a pacifier in the mouth of the baby right now. We have to fix it, and this is where we're going to fix it from, and we need to do it soon. All right, that is what I wanted to say. I didn't know if any of you had any questions or wanted to overlook this today or whatever that's here, or either request to get your own copy.
I would request to look at it.
Yeah, to get your own copy, but this is it. It was really hard trying to get this information, but we finally did. All right.
So this information is a matter of public record and was provided to you by?
It was provided to me by our legal department.
Okay.
Our legal department.
So I'm wondering if those are all digital documents, whether or not they are part of open data or not.
They probably are.
If you can ask Slade to combine all of that into a link, then that would be probably more efficient for us to look at, and also in our efforts for full transparency for anybody to be able to look at it.
Yeah. Well, they did have a link that they were going to send it through, but I'm a paper guy when it comes to this. I want to be able to flip back to it and say, no, it doesn't say this here.
Yeah.
And, I don't carry it around my digital, but that is good to be able to
just
have
for
that.
everybody. I mean, because if there's a very distinct link on the Health and Hospitals Committee page, on the Metro Council page, then that, because they can easily do that. So anybody who wants access to it.
Yeah, because this was something that was not readily available to us.
Crowdsourcing's the thing, man. If somebody sees something that can be helpful, then
Definitely.
Yeah.
there are a lot of people that.
And it looks like there's $4 million. It's supposed to be $4 million per year until 2024. And
40 or 4?
$4 million per year payments until 2024. And I know we're paying a lot more than that.
Yeah, so we have to really get into that. And so, I think I'm glad you did that, and make it all of our charge, since we are the hospital committee, to jump in where we can. I know we got some other issues. That's the thing about being a council member. You got many issues, right? But as the committee, I do hope
A couple of at-large people here with extra time.
Oh!
I would charge us. Yeah, right. I would charge us.
I have no idea what that is.
So,
Extra.
Now, Mr. Overlock's here with us. Do you have an announcement? Do you guys have a meeting tonight, right?
By the way, the lease actually runs through 2027.
Oh, okay.
Because the 30 years starts on the date of occupancy.
Oh, okay.
Payments started in 1994. So it was a $30 million bond to build out the hospital from the old Hubbard facility. The total payments are $120 million, which is roughly 13.6% interest. So I've heard the 2024 date a few times, but it actually goes out to roughly December 2027.
That's what the contract says.
Right,
It says
but later in the contract, it
Yeah.
talks about occupancy date.
Yeah,
So anyway,
so
but
we'll get through it.
on behalf of Dr. Webb, he would love to be able to speak with you all for 2 minutes the next meeting, if he could, about plans and so forth. If that-
Sounds good.
If you're, with your permission.
Yeah, definitely. We're the hospital committee here. Also, you have a meeting tonight, right?
There's a meeting.
Yeah,
at,
Meharry has it.
Meharry's having it.
Okay, so we just want to, for our listening audience, because we are on TV, so we wanted to let
First
them know.
Baptist Capitol.
First Baptist
Started
Capitol Hill.
5:30, 10 minutes ago, goes till 7,
Okay, and they will be having a series of these meetings, right?
from what I understand.
Okay, all right, very good.
Do
So-
we know what the meeting is about?
They're listening.
Listening
It's a
sessions.
listening committee,
Okay.
listening community meeting.
Okay.
In order to hear from the community and hear their concerns and whatever it is that they'd like to say.
Okay.
So, yeah, maybe we can
It's
make
my
one of those.
understanding.
Yeah, it sounds interesting.
Okay, well, I appreciate all of the committee members being here, and with that, I will not belabor us. Thank you so much
Yes.
for your attendance.
Thank you.
I have one of the best committees around.
That's right.
Believe that, Nashville. Thank you.
Yeah.
All righty.